UK scientists warn that the South African COVID-19 variant may be resistant to vaccines and more difficult to pick up through testing. Marvy Delphine will give us the details live. Marvy?
Steph, as the UK began its rollout of the Oxford-AstraZeneca vaccine after starting to deploy the Pfizer-BioNTech shot in December, scientists are particularly concerned that the new South African COVID-19 variant could be resistant to the COVID-19 vaccines approved or still waiting approval in the US and Europe. British Health Secretary Matt Hancock has then called for the immediate closure of borders amid fears that the new, more transmissible South African variant poses even more of a risk than the B117 variant discovered several weeks ago in Britain. Dr. John Bell of Oxford University, who advises the UK government's vaccine task force, said that the vaccines would work on the British variant, but added that there was a big question mark as to whether they would work on the South African variant. According to scientists, both the South African and UK variants are associated with a higher viral load. This means there is a greater concentration of virus particles in patients' bodies, possibly contributing to increased transmission. But Dr. Simon Clark, an associate professor in cellular microbiology at the University of Reading, said that while both variants were similar, the one identified in South Africa has more additional mutations. The South African variant carries 2 mutations at key areas of the gene, which builds the spike protein, a projecting arm that the virus uses to attach to human cells. Dr. Clark highlighted that any significant changes to the spike protein may mean the body cannot spot the virus even after vaccination or a previous infection. Worryingly, these changes may make it harder to pick up cases through PCR testing. There were also fears that people who have had the virus may not be protected from the new COVID-19 variant. The South African variant has spread internationally and has caused an alarming spike in cases, hospital admissions, and deaths in both Britain and South Africa. The UK has now recorded over 2.6 million COVID-19 cases and over 75,000 deaths to date, while in South Africa, over 1.1 million cases have been recorded and almost 30,000 deaths. Scientists said that further restrictions must be brought in to prevent the further spread of the virus and avoid overloading the health system. Steph?
All right, Marvy, thank you for that live report.